Hi, my name is Amy Reynolds. I'm 46 years old and I live in Greensburg, Indiana, and I have Crohn's disease. In early 2005, I was very sick with what I thought was the flu. I ended up in the emergency room after 3 weeks of dealing with it, with a very high fever, and I was very sick. They ran some tests on me and they found that I had inflammation in my colon, and I was in the hospital for a week. I was too inflamed for them to do a colonoscopy on me, and they decided they were going to treat me for ulcerative colitis until they could take further tests to determine if I had ulcerative colitis or Crohn's disease. I was sent home after a week on prednisone and sulfa medications. I ended up back in the emergency room within 24 hours in very bad pain, and I was very sick. I had a very bad allergic reaction to the sulfa medications, resulting in acute pancreatitis. I was in the hospital for a week with that, and I was sent home on different oral medications. I got a little better. In between that time and fall, I ended up in the hospital again for a week at a time. I was very sick. I was very dehydrated. The ER doctors said that my body functions had actually started to shut down. They got me stable, and in December they were finally able to do a colonoscopy on me, and the tissue samples indicated that I had Crohn's disease and not ulcerative colitis. Right before Christmas, I started on my first Remicade infusion, and I was on Remicade treatments for about 8 months. I got a little bit better the first couple months. However, I never did respond to it like a lot of people do, and I developed a very bad skin infection with a secondary skin infection on top of that, so I was taken off of that. I was on antibiotics and prednisone for several months to clear up the skin infection, and then my doctor started me on Humira injections biweekly. I was on Humira injections for several months, and I did feel better. I was having a better quality of life. However, in August of 2008, I went into a very bad flare again, and I got very sick and dehydrated, and I ended up back in the hospital, and my body functions, of course, were failing again. I should know better, and I hope you all do too. Don't wait, go. Don't get to the point where your body functions shut down on you. I was too inflamed at that point. They wanted to do a colonoscopy on me again to compare to my previous one, and I was too inflamed, so they couldn't do it when they tried. I was then increased to weekly Humira injections, and I was sent home after a week. I did very well on weekly injections. I never was in remission. However, I was able to lead a halfway normal life. I was able to go places. I was able to go out to eat. I was able to work. I did still have very bad symptoms at some times. In April of this past year, I found that I had abscesses in my perianal area, and I had fissures, which are tears in the rectum area. My doctors took me off of Humira 2 weeks before my surgery, which was scheduled for April the 30th, to give my body time to get ready for the surgery, and they said that I had to be off of it until my body healed after the surgery. About a week before my surgery, I felt like I was blocked, and I had a CAT scan done, and it did show I had a partial blockage. However, the barium drinks, it unblocked me, so I didn't have to worry about that, and I went on, and I had my surgery, and after that point, I became very sick. I was in a bad flare. I was put on prednisone. My doctors wouldn't put me back on biologic drugs yet. I kept begging them to. I was getting sicker and sicker, and I was losing lots of weight again. Finally, on July the 9th, the surgeon cleared me that my surgery was successful and it had healed. I had healed on the inside, and they put me on Cimzia. I was on Cimzia from July 9th until October 27th. Cimzia is a very good drug. It just did not work for me. I didn't get any relief at all from this drug. when I went to see my doctor on October 27th, he took me off of Cimzia. He put me back on Humira weekly, and he also decided to send me to the Cleveland Clinic in Cleveland, Ohio for a second opinion and drug treatment options, as he said he was out of options with me, being I'm allergic to so many medications. So the week of November 15th, I went to the Cleveland Clinic. I met with a wonderful gastroenterologist there and a wonderful surgeon. I had an upper scope and a lower scope from another wonderful doctor there. And right now I'm just waiting for my small intestine tissue results to come back to see if I will have a permanent ileostomy or a temporary ileostomy. My Crohn's is based in the small ileum valve area all the way down to my rectum. The surgeon said that he would consider doing a temporary 2-year ileostomy on me if I don't show any signs of Crohn's or cancer in my small intestines at all. There wasn't anything visible by the eye, but he wanted to wait for the tissue samples results to get in. So right now I'm just sitting and waiting, and I'm hoping and crossing my fingers, and I just want you all to know that we will have a cure one day. We will have better drug treatment options, and everybody needs to keep smiling and just keep believing that. Thank you. Bye.